can stretch. The second muscle that likes to get tight is the front of the shoulder. So what you can do to test this is see if you can grab your hands behind your back. If you can, excellent. The second thing, you want to stand over here. Yep. The second thing you do from here is see then if you can straighten out your elbows. You notice I'm having a little bit of trouble. And then from there you want to see if once you get your elbows straight, if you can lift your hands backwards off your butt. I cannot, but if you can, excellent. If you can't, you're going to want to grab a stick, a towel, something so that you can kind of get your hands. You can do upward grasp or lower grasp, whatever feels better, even mixed if you want. And what you do to stretch this is you bring it backwards like that until you feel a stretch on the front of your chest. And I like to go this way. You can have a partner come and grab it and hold it to kind of so you can really relax into it. And you just want to really feel the front of your chest from about here to here. Get a good stretch, kind of here to there on both sides. And it feels kind of good too. This is a great one to do in the pool. If you have a pool membership, get your hands behind you on the ledge of the water and walk forward a bit and just stretch it out. Okay, from there, the other thing you can do to treat SPD is the dreaded SPD belt. Pretty much every patient that complains to their doctor about this or goes to physical therapy to get treated for SPD is told to wear an SI lock brace or a similar brand brace. And they tell you what you do is you put your leg up on a chair and you feel for the crease right here. And I'm doing my old school physical therapy voice, which is my mother's accent. Sorry, Mom. And once you kind of find where that crease is, you bring it back here. And you put that right so the middle lines up with your spine. And then, honey, you put your knees together and you just put it on nice and tight. And that will cure your pain. Now you're good to go. Now go have your baby and it'll go away after that. This helps some pregnant women with SPD, but most of them find this incredibly annoying, me included. I'm really bad. I don't wear mine until my pain gets really, really bad, and then I'll put it on. But a lot of therapists swear by this and say this is going to cure you. And if this makes you feel better, great. If this makes you, like me, feel worse most of the time, don't wear it. Wear it when it helps. Take it off when it doesn't. Again, doesn't do a whole lot for me. Some of my patients love this belt, though. I give them this, and they just don't. They put it on. They come back a week or two later and say, this is so much better. I can handle my pregnancy. I'm good to go now. And part of me wonders if the belt is actually doing that or if they're just like sick of seeing me at therapy and using it as an excuse. But hopefully they're telling me the truth and that patients love this belt. Now I showed you the crease. You line it up with the crease. Some patients like it a little bit higher, some like it a little bit lower. Play around with the position and see what you like best. But for about, I'd say 80% of patients, lining it up with the crease of your leg is what feels the best. So, what else? This is your friend, okay? This is called a reacher. One of the things that's hard when you have SPD is picking stuff up off the ground. And if you're like me and you have a 3-year-old, you pick a lot of stuff off of the ground. So get a reacher. You can find them at like home improvement stores, dollar stores sometimes have them, and use it to pick up those toys that need to be put away and put them away so you don't have to constantly reach down and pick stuff up off the floor. This is wonderful. This is your friend, okay? It's going to be great postpartum as well. So spend, the $20-30, get a good one. You'll love it. From there, the other thing you can do is a very simple exercise that can help in the moment when you're having an exacerbation of pain. So when it really, really hurts. And also you can do it prophylactically just throughout the day. And that is squeezing your knees together. And just squeeze them together as hard as you can until it feels good. And then keep it there for about 4, 5, 6, 10 seconds, whatever feels good, and relax. This is something you're not only going to want to do as like an exercise, but also as a way to make some of the motions that hurt when you have SPD feel better, like rolling over in bed. When you roll over in bed, you can put a pillow between your knees or just your knees together or your hands there, whatever feels best. Squeeze that pillow, squeeze your hands, squeeze your knees together, and keep those knees pushing into each other as you roll over. It'll feel much better, I promise. From there, if you're getting up from a chair, Same thing. Squeeze your knees together, stand up. When you're sitting down, squeeze your knees together, sit down. And you don't have to move the camera. If you've got a purse and you want to kind of do it more conspicuously because you're out in public, squeeze your purse. Squeeze your purse. Same thing, okay? I promise you, it may not get rid of the pain, but it'll make it way less severe to do those transitionary motions if you squeeze your knees together. Okay, 2 more things you can do. The first one is when you get in and out of a car, you do not want to do like a nice long step. What I mean by that is if like this is my car right here, and here's like I've opened up the door, you don't want to step in like that and then sit down. That's not going to feel good. You want to back up, sit your butt down, and then swing your feet around and drive. And get out the same way. Swing your feet around, face totally towards the door, and then get up. And again, squeeze those. Okay, so the last thing you can do is what we call the break the stick exercise. And what you do for this one is you put your hands on your hips and you try to figure out what hip is higher. Okay? Can you tell which one's higher there? I normally look in a mirror.
It looks like that one.
This one's higher? Again, I used to be able to look down and see, but I can't now because I've got a belly. So this side looks higher over here? Okay. So the side that is higher goes low. And what you do is you sit down and you put the stick so that the low leg is underneath and the other leg's on the top. And then what you do is you try to break the stick. So this leg's going to pull up and this one's going to pull down. And you do that motion with as much force as you can without any pain or discomfort at all. Like you should be able to breathe normally. Nothing should hurt. Nothing should feel like it's digging. It can be as little as much just as kind of feeling those muscles engage. Okay? And then again, you try to break the stick as much as you can without it hurting. And you hold that for about 5, 6, 10 seconds, whatever feels good, and relax. And you're going to do that about 3 times. All right? So I'm going to do that one more here. And one more. And what this does, most of the time, we'll see if it happens right now, is it gets your hips to kind of level back up again. So now if I stand and kind of put my hands on my hips, do they look level now or are they still off?
Maybe a little better. Maybe better, yeah. Sure.
Better is which one looks higher?
That one.
That one again? Okay, so same thing. I'd sit down and do another round of trying to get that to even up. And again, look in a mirror because I don't know if I trust my husband. Hopefully you can tell which side's higher. And feel free to move the stick around if you're like me and you kind of start to wimp out and it feels kind of like there's pressure. Okay. March a little bit. How do they look now?
Sure, even.
Even? Okay. There you go. And why is it important to have your hips even? Because one of the things you want to avoid when you have SPD is kind of shifting your weight onto one side or the other. You want to try to keep your weight even on both legs. And often if one hip is kind of tight and pulled up, like mine was, your weight doesn't go even on both legs. You end up putting more weight on one side and then the other without even knowing it. So again, kind of trying to keep those hips even with the break the stick exercise can make things feel better. So there's SPD in a nutshell. Hope that helped.